Good afternoon and welcome everyone to the briefing for the final report and recommendations from Vermont's Child Care and Early Childhood Education Systems Analysis. My name is Dr. Morgan Crossman and I'm the Executive Director for Building Bright Futures, or BBF. And as many of you know, Building Bright Futures is charged in state statute as Vermont's Early Childhood State Advisory Council, which is the primary advisory body for the governor, the legislature on the well-being of children prenatal to age 8 and their families in Vermont. Today's briefing is a part of Early Childhood Grand Rounds, which is hosted by Building Bright Futures and Vermont's Early Childhood Data and Policy Center. And our role in facilitating this study and hosting today's briefing is one example of our statutory role to monitor Vermont's early childhood system and support accountability and data-informed decision-making. I'd like to start today's briefing by providing a very short overview of Building Bright Futures' role in facilitating the systems analysis, or Vermont's Child Care and Early Childhood Education Systems Analysis. And then I'll hand it over to the team of national experts that we've hired to complete the analysis. Nasha Patel from Watershed Advisors and Elliot Regenstein from Foresight Law and Policy. Today's briefing, you'll hear a little bit about the final recommendations, a review of the process, and the recommended next steps. Very briefly, a couple of housekeeping items. Please feel free to put any questions into the Q&A and we'll do our best to address as many as possible at the end. We're going to leave the chat open for anyone to introduce themselves if they'd like to see who's in the virtual space, but please put all questions into the Q&A function. So to start, for those who are not as familiar with the analysis, the goal of Vermont's Child Care and Early Childhood Education Systems Analysis was to examine the systems that govern and administer child care and early childhood education, and then use this information to figure out how we make recommendations to improve the functioning of our early childhood service system to ultimately improve outcomes for kids and families. Last legislative session, the legislature tasked Building Bright Futures to oversee and facilitate the systems analysis under H171, which turned into Act 45. So at Building Bright Futures, as Vermont's independent public-private partnership for early childhood, we supported and monitored this analysis in a range of ways. We started by running a really rigorous procurement process, which resulted in the hiring of Foresight Law and Policy and Watershed Advisors as the team conducting the study, which just concluded in June 2022. We also compiled a very robust list of documents for them to conduct a systematic document review and worked hard to orient them to the project in Vermont and the current status of our system. We also work to build and facilitate a diverse group of stakeholders to serve as the advisory committee for the study. And so their responsibility was to oversee the process, ensure that they had consistent feedback over the course of the study, and ensure that we had a rigorous process and final report. That group of stakeholders was created in part by some of the existing committees that Building Bright Futures hosts. We also supported them in facilitating interviews, focus groups, and a survey of over 300 early childhood stakeholders that included families, early childhood educators, agency leaders, and a multitude of others. We also worked hard throughout the process to ensure diverse stakeholder engagement across the state and provided multiple mechanisms for everyone to make sure that their voices were heard. One really important note before we get started is that the Building Bright Futures State Advisory Council does not directly support or oppose any specific proposal or piece of legislation, but we're really proud of the rigorous process that led to the recommendations that you'll hear about today and in the report. And we're really confident in stakeholders' ability to come together in the next couple of months to make deliberate, inclusive, and transparent changes that will really strengthen our early childhood system and do what's best for kids and families. Building Bright Futures was honored to facilitate this rigorous study and ensured that diverse stakeholder feedback was included at every step of the way. And we're really excited to host future discussions with the State Advisory Council and early childhood stakeholders statewide to ensure that we're using this data to continually make data-informed decisions and recommendations that will improve outcomes for kids and families. We have a really strong vision in this system that was collectively created by over 400 early childhood stakeholders. And that system is an integrated continuum of comprehensive, high quality services that's equitable, accessible, and will improve outcomes for each and every child in the prenatal period through age 8. Finally, because of the intent of Act 45 for the finance study, there's a ton of work that's being done to support integration and alignment between the finance study and the systems analysis. So Building Bright Futures has committed to supporting the Joint Fiscal Committee and the Joint Fiscal Office to conduct that finance study alongside of RAND, who are the contractors that will be overseeing that study for the Joint Fiscal Office. We've already held an orientation for RAND in the Joint Fiscal Office and provided publicly accessible information and documentation to start their review. And the Systems Analysis Advisory Committee from the systems analysis will also be supporting and extending their responsibilities to guide the finance study as well. So the finance study will be used alongside this report and is due in January 2022. So at this time, I'm pleased to introduce you to our consultant team that conducted the systems analysis, starting with Nasha Patel from Watershed Advisors.
Hi, thank you so much, Morgan, for handing it off to me. So I'm going to walk through the first part of this presentation and then hand it to Elliot to talk about the rest of it and bring it home. If you have questions, you can put them, as Reba has already started to do, in the Q&A part of the Zoom feature, and we'll sort of address them as they at the end of the presentation. Great. So let's start with just a brief overview. We were brought in to conduct this systems analysis because there was a sense in Vermont and from your legislature that there was a need to do more to help children and families in Vermont's early childhood system, but also the providers in the communities that are doing work on early childhood. And so to get a sense of what was actually happening in the Vermont early childhood landscape, and what could we as consultants, as folks who work in a more national context, advise based on the takeaways that we had from talking to you all, from doing the extensive document review that Morgan referenced, that could be sort of considered options for Vermont to consider for your early childhood system. So that's what you'll see in the report. If you haven't had a chance to read it yet, you'll see an overview of our approach and also our recommendations, a deeper dive into the current landscape, which represents really many, many conversations that we had with a diverse group of folks that were iterative, meaning we talked to them once and then came back and shared more feedback and more information and got more feedback over time. And that led to a set of options that we'll talk about today, and then our conclusion. So what you'll see in the report today are these things: the landscape, the options, the recommendation and analysis, alongside the other pieces that I referenced before. How did we get here? We had many conversations, many interviews, both in small group formats as well as some larger group formats. We had individual conversations as well as opportunities to talk to a set of 4 or 5 people together. And these conversations were not just with early childhood providers and teachers, but also with folks within CIS, pediatricians and other healthcare professionals, folks within state government, but also within local school systems and other local level organizations, and covered both childcare, Head Start, and preschool, as well as health services, home visiting programs, after school programs, and really ran sort of a range representative of the early childhood landscape itself. We reviewed several documents that you all have sort of been on a trajectory of putting together. Vermont, this isn't the first time Vermont has thought about its early childhood system, where it is and what it needs. And we looked at documents that sort of contributed to the picture of where Vermont was and where it is now. We created a landscape document to provide you all with a sense of where we thought the Vermont landscape was based on our conversations more holistically, and got feedback from you all on whether we were on the right track through a bunch of stakeholder meetings. That led to the options document. We didn't start with an options document saying sort of, here's what the different governance models are that exist in the country, and here's the choices Vermont has, because we truly wanted to start the conversation from where are you now and what's working and what's not, before we got to, okay, and here are some choices, some options for Vermont to consider. And when we did get to the choices and the options, that document and what you'll see in the report shows sort of here's what the national options are and here's how that might look in the Vermont context. So when we got to that part of the work in our methodology, we really made sure to take into account the unique circumstances of Vermont and how that does and doesn't match to different state or national models of early childhood governance. We then had a survey that went out and that gave us sort of feedback on what folks thought of the different options, what made sense or didn't for them. And all of that work, those conversations, the report reviews, the landscape, the stakeholder meetings, the options documents, and the survey, all of that helped feed into this draft that we have, this report, and what we're sort of recommending happens next in Vermont. So I'm going to go through an overview of the recommendations and start with the landscape piece of it. And then Elliot will sort of walk through a more in-depth conversation about what this report is recommending. So we want to start this conversation from recognizing that when we talk about a set of recommendations for the Vermont early childhood system, we're truly talking about addressing systems problems that require a system solution. This is not about any one individual or any one agency working in the system. It's really about how the system is set up and how each person working within the system, from the provider level to the community level, at the nonprofit level, within state government and the various state agencies that are part of administering this, their roles within it, and how to sort of best optimize the work and the efforts that they put in every day to providing high quality experiences for kids and families, and how to make sure that every dollar that goes towards that, every sort of hour of work that's going towards that is operating within a system that is most efficient, most helpful, resulting in the best outcomes possible for kids and families. When we talk to folks living in that system, again, at all levels of the system and sort of the range of roles within the system, they recognized and told us up front that this wasn't optimal. As outsiders, we can say that we agree. When we say that the status quo isn't working, a lot of what we mean is that there are lots of people who work really hard in their day jobs that are often not day jobs, that are often night jobs and weekend jobs and all-hour jobs to solve challenges faced by children and families, but there are barriers within the system that frustrate their work. And these barriers range from like small things related to how costs are coded to large challenges related to where children get services, what they're eligible for, what families can and can't access in which parts of Vermont. And so when we talk about the need for a systems change, that is really the biggest point that came across in every single one of our conversations, everything that we read and reviewed, that the status quo wasn't working, and that many people were working every day within a system that sort of failed to make their best efforts and their best work realize the true possible outcomes for kids and for families. So state government customers, the providers, the different contractors, the local level government folks, the families, and the teachers, they want to change. And we want to make sure that our recommendations help channel that energy towards something new, something better. There has to be a better way of doing this. Channel that energy constructively. But we know from our work, both my work as someone who sort of worked within the system in a state, and Elliot's work both inside and outside of government, and our work with other states and on other projects that are similar to this, we know from all of those perspectives that a systems change, even the most optimal one, even the one that's best set up to succeed, isn't guaranteed to make things better. It really is the start of a process and not the end of it. Choosing a model and a path is the beginning of a new body of hard work. It means coming together to say we want something new and better, and we're committed to making this happen. And we know that this is step one of many steps to come that will ultimately help make sure that the things that we want to be true for kids and families in Vermont can happen. And we know that this work isn't just going to happen at the local level. And in fact, the lion's share of the work is going to end up being done by state government leaders. This is complicated work and requires complicated solutions that take on really a large amount of the burden right now that's being placed on families and providers to navigate the system and place it on state government. So that does require a lot of work and a lot of capacity at the state level. The most important thing that you'll see in our report is unified and elevated leadership, meaning that right now there's no one in Vermont who wakes up and says sort of like, this is my ball. I'm responsible for ensuring that all children under 5 before they enter school have access to the care and education services and supports they need. So what you'll see in the report is a recommendation to unify early childhood programs and elevate the leadership of that, such that there is a single leader who's responsible for a significant cluster of programs and who has a charge to unify policy, who's responsible for saying it's not just enough to operate several grant-funded initiatives or programs sort of in silos, separate and distinct from each other, but actually we need to bring these things together and recognize that the needs of children and families both before school and before kindergarten are essential to be sort of viewed as a whole and not as distinct. This changes the vision of what's possible for government to achieve, what's possible for local leadership to achieve, what's possible for individual programs to achieve as well. Another thing you'll see in the report is that this requires some defined metrics of success. We need to be clear about what we're trying to accomplish and why, and what that sort of unified and elevated leadership would be responsible for achieving. Without this sort of unified system, Vermont cannot achieve its goals for children and families. We cannot get to a system that uses all of its dollars in service of every child having the experiences they need before kindergarten, without being clear about what the various levers are and how they're all going to be pulled together towards achieving Vermont's goals for kids and families. So once we sort of accept that a unified system is needed, the next step is to consider where it can be placed in order to ensure the greatest success. So you'll see in the report a couple of different paths that are considered to getting to that most important thing, unified, elevated leadership. You could consolidate at agency of education. This would prioritize connecting early education and care to the broader K-12 system and building sort of a birth to 12th grade system. You could consolidate it at AHS, which would demonstrate that you were prioritizing connecting early education and care to the broader range of early childhood services that we know young families and parents of young families need before school entry to be sort of set on the path for success. Or we could consider creating something new, a new agency or a new department that prioritizes the importance of early childhood as a policy area, says this is actually a distinct thing from either K-12 education or human services. It requires a different approach to its unique stakeholders and unique problems. Or you could create a new coordinated office. This is sort of the least impact of change while creating a single point person. So it leaves sort of programs where they are, it's the least disruptive, but it still gets you to the point of having unified leadership that is elevated and that can say this is sort of the vision for what should be happening for kids and families. What we're recommending in our report is to create a new unit of state government whose leader reports to both the secretaries of Agency of Education and Agency of Human Services. So again, recognizing that early childhood care and education is distinct. It sort of crosses both education and human services. And both agencies have important expertise to contribute to the early childhood field. But neither agency on its own is positioned to be successful in overseeing the mixed delivery system. So I'll walk through a little bit of the current landscape that led us to this set of recommendations, and then Elliot will go into more depth of each one of these recommendations. And so you'll remember that we had a previous report that talked about the landscape of Vermont and the early childhood sort of different components that you see here: state government capacity, local capacity, the human services education dynamic, children's integrated services, special education, collaborative structures, and data. I won't spend too much time on this but this is the background that led us to the recommendations that you see in the report. So just briefly, when we talk about state government capacity and how it sort of led us to making these recommendations, some of the things that we were looking at as we looked at leadership capacity was both the ability within agency and then across agencies, meaning the multiple agencies that are involved in early childhood leadership. Where were their opportunities and where was their capacity to really step up and build and take on some of the burden that providers were speaking to, that communities were speaking to, that currently was being sort of managed or carried at that local level. There were concerns raised about AOE and their relationships with private providers. And there were questions about CDD and how it currently sort of operates, especially given sort of moves that were made in the past that led to sort of a question about its future and the relationship that CD had with community leaders who are doing the work now and the staff that were in place in CDD at this point. There were questions too about staffing levels at each one of these organizations and whether current staffing levels or even when staff were sort of fully in place at either of these organizations, there were enough people to manage a complex early childhood system at the state level that did sort of take on that burden, that did create unity and coherence at the local level for kids and families. At the local level, there are so many exceptional local leaders in Vermont who are doing just incredible work on behalf of kids and families, but this did vary across communities. There were real concerns that were raised in conversations that certain experiences were true if you lived in some parts of Vermont and were not true if you lived in other parts of the Vermont, which sort of named that there needed to be a state role in helping to make sure that regardless of where you lived in Vermont, there was a minimum set of experiences that families could expect to have. There was also a real articulation raised of a need for coherent local systems, especially given sort of misalignment of geographic boundaries. Right now, there are challenges related to what programs are sort of operated at a school system level versus at a regional level, where the boundaries were drawn and how they didn't relate, right? So Head Start boundaries didn't relate to school system boundaries, didn't relate to council boundaries, didn't relate to CIS boundaries. And so the challenges that created for program leaders, for provider leaders, for community leadership, as it came to marshaling their resources to address problems and to do that equitably and consistently. We also ran into many times in conversation and have raised before the camps, this idea of human services and education sort of dealing with different stakeholders and having different perspectives and different approaches as it came to managing private and public providers within the same space, with public schools and public education programs, particularly preschool programs, falling really more directly under the AOE auspices and having a really strong relationship with AOE, and then private providers and the mixed delivery model being more supported and more integral to the approach of the human services organizations. There's also this third camp of public health that played in, particularly as it relates to CIS. And there were real concerns as it related to health services provisions and home visiting provisions that directly fall under this sort of like more public health orientation. This meant that sort of each agency and each office within these agencies, they had different norms and expectations. They interacted with different stakeholders. They had different levers that they felt were integral to their approach to solving problems, and different sort of purviews as it related to who's the client, who's the customer, who are we most oriented to, who are we most serving and talking to and working closely with. And that played out really significantly in conversations about preschool. And, you know, the hope for a mixed delivery model that was operated, or sort of the point of where the funding was flowing from were school systems, and the reality of the challenges that raised for private providers and a mixed delivery model that didn't align necessarily with the school system boundaries or the school system organization, and the challenges that that left at the local level in terms of this dynamic of private and public, and what AHS was responsible for and what AOE was responsible for. Other sort of aspects of infrastructure that came up in our landscape analysis were children's integrated services, and the sort of the real work that children's integrated services had done to try to do some of what this report talks about, take increased coherence at the local level, and take some of the burden off of families to sort of find the opportunities that were sort of best for their children, and find the providers who sort of were able to most serve their children, find the services that they needed, take that burden off, and start to, at the local level, increase coherence. But there were challenges with that too, particularly around data, and around sort of which programs should belong in the bundle and how should the bundle be sort of financed and funded. So challenges about the complexity of children's integrated services and operating that from a state level while also sort of having the local governance attached to it. There are challenges related to special education that were elevated in our landscape conversation as well, particularly if children who were receiving special education services from the school system were also electing to do universal preschool in a mixed delivery setting. What did it look like to get those services? Who is responsible? And especially when sort of services or need for services cross geographic boundaries, how to navigate that at the local level. In Vermont, there are many collaborative structures and folks named with a sense of pride sitting on lots of them, councils at both the state and the regional and the local level. And also whether those collaborative structures were sort of meeting their full potential or their full promise to achieve real change within the Vermont system. And finally, another aspect of the infrastructure that was raised frequently in conversation was the need for improved data that could help to drive decisions for really all levels of the system at the state level, but also at the local level as well. And so with that, I will hand it to Elliot to talk more about the governance models and the options that were presented in the report.
Thanks so much, Nasha. And I will start by talking about some of the options that other states have looked at that we used as sort of a frame for our discussion, and then talk a little bit more about what we recommended in Vermont and why we recommended it. So there are three different models generally referred to nationally when it comes to early childhood governance. One is coordinated, and here the term coordinated refers to not necessarily what's actually happening, but what is required for the system to function. And that's because in a coordinated model, multiple important programs are in different agencies, including if you're focused on early education and care, pre-K and childcare in many states are in different agencies, as they mostly are here, right? I mean, that pre-K is within both AHS and AOE, but that there is definitely dual oversight within those two major programs, and then other programs that, as we'll see, are also split into different agencies. So coordinated states that have a coordinated model sometimes have a centralized governor's office that is meant to sort of help with that coordination, but that is different than having line oversight over the individual funding streams. A consolidated model is one in which you take the core programs, and again, this is at least childcare and pre-K, potentially others, and bring them into a single agency, but it's an agency that has responsibility for other functions as well. So most typically, this will be a human services agency or an education agency. And again, different states have different rationales for why they've done this. With, again, as Nasha said, with human services, it's to connect it to other services being given to children birth to 5. With education, it's to connect it to the longer K-12 spectrum. There are examples of both of this, and there are states that started as one and switched to the other. Finally, there is this category of creating something new that is a standalone early childhood agency or entity. And there are a number of states that have gone that route. The nearest one to you is Massachusetts. But that there's also been a little bit of a trend toward this in a couple of states that have acted within the last few years to do this, including Colorado, where Nasha has been actively involved in their efforts. And this is, again, creating a commissioner or agency head level leader who is focused solely on early childhood. And as Nasha said, creating that person who has authority over multiple early childhood programs and an elevated level of leadership. So the next slide talks about Vermont's current status. And again, as all of you know, Vermont is under the typology of coordinated, even though what we heard was that the landscape is really fragmented, that there's important work going on at AOE's Early Education Division. The AHS Child Development Division has a meaningful chunk of the early childhood system. And then there are also some functions within the broader early childhood system that fall within AHS's Maternal and Child Health Division. Worth noting, and you'll see this as a consistent theme, that the State Advisory Council is a shared space for collaborative work among all of these sectors. So when you look at why states might make a change, right, it's really important to be clear on the purpose. And in the report, we talk a little bit more about some of these purposes, all of which came up in the course of our conversations as things that stakeholders in Vermont are interested in seeing done. Nasha already talked a little bit about the idea of minimizing the burden on low-income families trying to access services, right? That if you've got everything under one roof, or at least some chunk of it under one roof, that agency can structure things to make it easier for the families who are seeking services. And again, I know many of you, probably all of you on this call, are sensitive to the idea that low-income families with young children have incredibly limited bandwidth, and that the easier we can make it for them to access services, the better it's going to be for them. Ensuring quality across the full range of services, right? Making sure that those definitions of quality line up from program to program. Expanding access, right? Who's advocating for a holistic approach to expanding access, not just for individual funding streams. Creating effective service delivery, right? We'll talk about this a little more on the next slide, but that there are certain functions of delivering services that can potentially be run more effectively if they're under the same roof. And then also elevating the level of leadership on early childhood issues in state government. This is a hugely important one that has been a major motivator in other states and definitely came across in many of our Vermont conversations. And the idea that however talented your division managers are, that there are certain kinds of advocacy and kinds of leadership that can only be provided by an agency head, or in the context of Vermont's human services structure, a commissioner level leader who is more empowered to speak to the public at large, speak to the legislature, and represent the entire field. And that is, in some of the states that have made changes previously, something that they talk about as a major motivator in, they wanted to have that level of person to negotiate on a more equal footing with leaders from other sectors of state government. So I mentioned the core functions of state government. And again, in the report, it talks a little bit more about all of these core functions, all of which we heard about from stakeholders in Vermont, and all of which are areas where at least some stakeholders felt that having a more unified structure of the kind we described would be advantageous. So first, setting a vision and holding stakeholders to it, right? That's work that Vermont has been doing and is continuing to do, but it hasn't sat within state government agencies and the executive branch in quite the way that it might and does in some other states. Managing funds, right? And there's also a finance study going on. We can talk more about that if people are interested, but that whatever funding streams are being managed, how is the state thinking of those in a more unified and holistic way? Setting standards for quality. This is definitely something that came up quite a bit. And the idea that quality standards differ not only between pre-K and childcare, but in effect within the pre-K program, and that was a struggle that a number of people talked about. Different folks had different ideas of how they wanted to resolve that, but the fact of the problem was widely acknowledged. Supporting professionals. This is really key. Obviously, the quality of the professionals is essential to the success of any early childhood funding stream. And when you talk to parents, right, about what it is that brings them to programs and keeps them coming back, the nature of their child's interaction with the professional is always going to be at the heart of that. So again, in a situation where you've got some different requirements, some different expectations, different professional development for providers in different funding streams, this was something that folks really wanted to see unified. engaging with the field, right? How are you talking to families and stakeholders about early childhood, about the importance of those years developmentally, and about what services are available? That again is something that having a coordinated effort at the state level is seen as potentially powerful, both from a communication standpoint and from a program design standpoint, right? How are you engaging with families to understand what their needs are programmatically, in addition to talking to them about what the state has to offer? So in thinking about governance, how effective the state can be in any of these functions should be a central consideration. And all of these require capacity, right? That was something that came up in a lot of instances, is folks talking about how many people are working at state government, what skill sets they have, in addition to how they're configured, and a general sense that while folks in state government right now are doing everything they can, that there are not enough of them to do all that needs to be done. So in thinking about state government's role also, we come from a perspective of believing that state government has an absolutely essential role, but that state government is not there to do everything. And that part of its job is to engage successfully with communities and manage an ongoing partnership where the dynamics are really going to vary from place to place, right? There are some communities in Vermont that are doing amazing work that the state should support in any way it can. There are other places that want to do amazing work. They aren't there yet. And the question of what is the state role in helping them get there is one that is front of mind for us. It is worth noting that some amount of the fragmentation at the state level is driven by fragmentation at the federal level. I'm not going to go into all the details of that, but that the structures that the state has reflect some of that history. And again, it's not a knock on this current administration that it ended up that way. And kudos to this administration for engaging in the process of trying to solve it. And then again, as I mentioned, what capacity is state government going to have? How is that configured? And what are the skill sets needed for that to work? So one of the possibilities for the state is to consolidate into a single agency. And it is worth acknowledging that the agencies themselves have made meaningful efforts to coordinate with each other, and those are certainly to be commended. But it is also worth noting that those agencies have some very different orientations. And again, they come by those naturally. This is not in any way a criticism of them, but that they have different goals, they have different stakeholders that they work with primarily, different accountability structures. And that, again, that comes naturally from being in education or human services, which have some genuine differences in culture. But what it means is that the early childhood folks within those agencies have some very different approaches. And as long as they are housed within their existing agencies, it's unlikely that that will be fully resolved. And it's also worth acknowledging that there is concern from folks on either side of this about what it would look like to be sort of wholly subsumed by the other, right? It is certainly the case that schools are an absolutely critical part of the system, and AOE is their most familiar home. In many instances, we heard very positive things about those relationships, and that certainly rings true. So understandable that folks in the education community would want to keep those ties. It is also the case that the folks in the human services world have their own relationship with AHS. And again, and this is a conversation that looks similar to how this has looked in other states, they know that an education agency has its primary working relationships with school districts, and that those relationships are deep, they've evolved over many years, and that working with private providers is a very different enterprise, and one that, while education agencies can learn, will not necessarily come naturally to them at the outset. So there is a desire among some number of folks to think of this not as sort of A folds into B or B folds into A, but that as A and B come together to form this new thing. And it's worth noting also that we have seen examples in other states where efforts to fold one community into another agency, right? Either private providers into an education agency or schools into a human services agency, that the legislative conversations about that have become acrimonious. We are not saying that would necessarily happen here, but that is a concern, and that if that happens, that sometimes it can take a while, and by a while I mean years, for sort of everybody to settle back down and build the kind of relationships that are necessary for the system to succeed. And so we just wanted to flag the concern of not starting this process with like a pitched battle in the legislature, because then it is very hard for whatever fledgling enterprise is created in the executive branch to get off the ground with everybody feeling like they're on the same page. So that the goals of creating something new, right, are to provide that unified elevated leadership, as Nasha talked about, and to develop all of those consistent policies and alignment that will help the folks at the community level and among providers to really succeed in their jobs. And there is a lot that can be done administratively, right? Like more than people think. And that this is the experience of other states, as they go in thinking, well, we can't do X or we can't do Y. And then they get into it and then they realize that they can, right? The statutory parameters are often relatively broad, both in childcare and in pre-K. And particularly on pre-K, if there are statutory parameters that aren't working, you can go back to the legislature and potentially try to change them. And again, a unified agency might be in a better position to do that. It is also the case that a lot of this comes from, a lot of what families experience comes from what happens at the local level, and having a state government that is well set up to support coordinated local efforts can be a real advantage. And it was those reasons that we came to the conclusion that Vermont would be best off creating something new, to say, look, early childhood is its own thing, and it's tightly connected to both human services and education, but that it needs its own unit of government that is focused on not just human, sort of private providers or schools or childcare or pre-K. It's focused on the combination thereof and the ecosystem that creates. And engaging all stakeholders through that full birth to five system lens. Worth noting also that a structure like that does make it easier to integrate data from multiple sources, which can be really important for administering the program. There are definitely some number of folks we talk to who would like to see early childhood be its own full-fledged agency. I would say from our standpoint, we're not opposed to that, but that there are some practical concerns to that people raise that feel real, particularly with regard to how that would matter for early childhood accessing the education fund, which it does currently. And so what we ended up recommending was a hybrid approach where you create a new elevated unit of government that's got a single leader, but that leader has a dual reporting structure where they report to both the head of AHS and AOE. This is modeled after some pioneering work that was done in Pennsylvania some years ago. It is slightly different because their context is different than Vermont's, but that's sort of fundamentally the basis of the approach. Whatever structure is created, whether it's consolidation or creating a new agency or creating this dual reporting structure, the need for interagency connection will be real. Whatever is created, and again, our recommendations focused on early education and care, which is primarily childcare, pre-K, the Head Start Collaboration Office, and potentially some other programs, right? That those programs all still interrelate with a great deal of the rest of Vermont's, human services and health systems. So the need for interagency connection will remain strong, and the State Advisory Council can and should continue to play an important role. The things it is working on day to day may shift, and the dynamics within it may shift. And that may be true at the regional council level as well, but that the fact of having that is going to continue to be very important. It is also the case that creating new governance structures is not the same as creating a framework for interagency data sharing or for data integration, and that whatever data is held in this new unit is still going to need to be integrated with data from other units. So there will still need to be a conversation about data governance. So I'm not going to go into tremendous depth about this here, but only to say that the transition from what Vermont has now to any of the things we propose is a serious body of work that is not easy and takes some time, right? The first question is to determine the exact parameters of what's going to move. Once you've decided that, you have to identify where the capacity is going to come from, identify a whole host of logistical challenges. We've already identified some of the cultural challenges that are present, and there's going to be a lot of work to reset relationships between the state and communities. That requires dedicated capacity. This is a place where the process of transition is one that philanthropy and business leaders can play a really supportive role. But again, all of that has to be built out and defined. So we're getting close to the end. I do want to leave some time for questions, but a couple of thoughts I want to leave you with. One is that the governor's office has very appropriately had a focus on cradle to career education, and that's hugely important, and we don't want to minimize that in any way. But it's worth noting that we're not sure that having the best cradle to career approach requires having a single cradle to career education agency. And what is, in our view, most likely to be successful for the system as a whole is having each body of work governed by a unit of government that is prepared to be successful in managing it, and that this is our best sense of what that would look like for Birth to Five. It is absolutely essential to emphasize that neither AHS nor AOE has been charged with creating, this unified ecosystem. And I want to really, in this moment, thank the leaders from AHS and AOE who gave very generously of their time for this process, and from the governor's office as well. They have also been meeting internally to talk about where this work goes, and we want to really commend that, and we're really encouraged by that, and say that we know that that process is going to continue beyond the end of this report, which is great, because this report, again, just opens a new chapter of conversations, and we really hope the administration will be able to engage constructively in this next wave of discussion, and thank them for their efforts to both get us to this point and to participate in the next round of conversations. We do think ultimately it's important to emphasize that all of these programs that we've mentioned, universal pre-K, childcare, children's integrated services, should change if a new agency is created, and change in ways that are seen as positive for the field. Part of the goal is to have an agency that works with the field to strengthen these programs. We thought CIS was a great example of an effort to integrate programs, and would love to see a bright future for that work. We've heard about struggles in both UPK and childcare, again, that we think a change like this would be helpful to solving. So we know that this is not easy, but we ultimately think that this might operate more effectively than the current system. Again, these recommendations are meant to start a new conversation. We have now given you some specific things to react to. Some folks have already reacted. Others are going to need more time to think about what they want to say about this. That's great. That's how it should be. And we hope that the folks who need a little more time will get some grace from their colleagues in the field to work through how they're feeling about it and share some thoughts. So over the course of the next few months, right, those conversations should continue. And we anticipate, based on what we heard in the advisory council, that there may well be action on this when the General Assembly reconvenes at the beginning of next year. That's terrific, and we hope that folks will be preparing for that. And again, doing so in a thoughtful way and thinking about, if the General Assembly were to act, what would it do and what has to follow from that? Because if the General Assembly takes action and says that a new structure will be created, that's when the real work of transitioning from the current system to the new one begins. And that is a process that will take time, right? I mean, New Mexico is the example I usually use. New Mexico passed legislation creating a new agency, very early in the year in their legislative session, and set the launch of the agency to be July 1st of the following calendar year, giving them more than a year to get up and running. And they did budget in the state budget some funds for that first year to start hiring a director and one or two top deputies so that that person could hit the ground running when the agency began its existence at the beginning of the state fiscal year. So again, we're not recommending that specifically necessarily, but that a conversation about what a transition might look like is going to be an important part of this. And we'd urge people to start thinking about that over the course of the coming months. I'm going to stop there. Thank you so much for being a part of this process. Many of you on this call have been in it before and are now on it today. And we hope that you will continue to be actively involved going forward.
Thank you, Elliot and Nasha. So we do have about 9 minutes left, and we are going to look at our question and answer portal. And I'm going to read some of the questions and ask Elliot and Nasha to respond. We will go as long as we have time. So if you are looking to have some questions answered, please use the Q&A function. So the first question or series of questions that are coming through, Elliot and Nasha, are around the specific services and programs that would be housed within the unit. So there are questions around whether or not CIS, Head Start, maternal and child health, mental health would be included in this. What would that configuration look like, or what would your recommendations look like for those services? And is managing the child care financial assistance program and administering all of CCDBG in Vermont recommended to move into the new unit as well? So if you can just take a minute to address what constellation of services and programs.
Yeah, so that's a great question. And I sort of touched on this a couple of times, but happy to drill on it a little more deeply. I think we recommended really focusing on early education and care at the outset and not trying to make it sweep too broad. That was the original legislative charge. And certainly a lot of the conversations we had were focused on childcare and pre-K. I would absolutely include the Head Start Collab office as part of that. I think that you can, at that point, you can start to think about like what makes the most sense, right? Like some of the things within Child Development Division might be logical to move, others might not be, right? We didn't really get into that level of depth in this conversation and would absolutely suggest that as something that needs to continue. But from a principled standpoint, I think our recommendation was to start lean. And then if the agency gets up and running and is successful and people down the road want to add functions to it, you always can. And other states have done that. Nasha, I don't know if you want to add anything to that.
No.
Okay.
Okay, so another question that we have in the chat or in the Q&A portal is, how does the conscious distinction between childcare and preschool fit with advancing the early childhood education profession?
That's a great question. And I think part of the goal is to start integrating those things and making them less different. Again, some parents are probably keenly aware of the differences, others less so. And we've known of programs that sort of intentionally obscure the differences because they're operating both and they want parents to not think of like, children in one room doing one thing and children in another room doing a different thing. So over time, I think the goal would be, one of the potential goals would be to have these two programs integrate more effectively and look more like each other in certain ways that, again, you'd want to manage with stakeholders over time. So they will always be different to some degree in that UPK is free and subsidized childcare will continue to require copays and does get federal money and will be subject to some federal requirements. But again, in a number of states, there's been an effort to blur some of those distinctions, and we see energy around that here and think that a governance change might be a really important step toward managing that.
Nasha, anything to add on that? Great. So we have another couple of statements and a question on the importance of elevated leadership in Vermont's early childhood system. So the unified and elevated leadership was what we saw at the Child Development Division before the current administration. Why would we create something new when we haven't seen the administration prove that this can be done well? We in local communities work with both agencies on so many issues. It's not just childcare, it's not just pre-K. Children's Integrated Services does a really great job of supporting early intervention to special education transitions, kindergarten readiness, and all family programs. Elevated leadership is key, but it's not about having more leaders, it's about having that content expertise. Any reflections on any of those statements?
So points well taken for sure. I think that we, again, in the report are recommending a level of leadership even more elevated than what CDD currently is at, and a more direct connection to agency heads than CDD currently has. It is worth noting, and again, this is in no way meant to knock the folks who are currently in very important roles in state government, that one of the reasons that states have wanted those elevated positions is that to some degree you get a different candidate pool for commissioner level jobs than for division manager level jobs. And they are political, right? And in both the good and bad sense. But I will just admit, one of my formative experiences as a consultant was working with a commissioner in a state that had created a new, that had created a standalone early childhood agency, and that this commissioner was well connected to the governor and was able to get things out of other agency heads in a way that a division manager simply would not be able to. And that over time, having a structure that demands that an incoming governor appoint someone to that role, again, helps to shape a culture and create that kind of knowledge and skill base. So again, that is not a guarantee, but a sense that what the experience of other states has been is that creating those elevated roles has brought new skill sets into the field in a way that's been really valuable.
And also, I think recognizes the important thing that you're naming, which is that services and education are interrelated and need to be brought closer together. And having an elevated leadership position who's responsible for both, which CDD was not responsible for universal preschool solely, I think is both Elliot's point that you want a leader who feels responsible, feels tasked with, and is actively seeking a job that requires them to do both, to play both roles and to bring both things together, and also find those other opportunities where that is true, where there are connections. I think EI is a really good example, and ensure that there is, as the report names, a customer or a client or a user-oriented focus towards building cohesion, which requires sort of relying on those local partnerships and those local leaders that you named, but also supporting them and reducing the barriers or the burdens they may face in offering high quality experiences for kids and families. So I think all the points that you're naming about sort of local leadership and the interactions with both agencies actually sort of supports the idea that we do need elevated leadership across both organizations to take on responsibility for a more coherent, a better, more streamlined process for kids, for families, for local providers, for local leadership.
Thank you. So we aren't going to be able to get to all of the questions, but I do want to give you both the opportunity to talk a little bit more about the relationship between the systems analysis and the finance study, as well as what happens now and how folks should be thinking about next steps.
Sure. And I will flag, there was a question about data, and I could talk about that all day. I'm going to put in the chat a link to a blog post that I recently wrote about the importance of integrating data and the main point that it's not necessarily about collecting new and different data so much as taking the data you already have and using it differently. But I threw that in the chat, and if anyone has follow-up questions about that, I'm happy to answer. With regard to the finance study, we have had a chance to meet with the team that's going to be working on that. We're really excited about that. I think one of our goals in this report was to try to set up a structure that could manage a more integrated approach to finance effectively, and think about how to leverage the different funding that exists in ways that sort of support community level work and children and families more efficiently, as Nasha talked about at the outset. So that work is hugely important, and we hope that folks who are engaged in that will think about these recommendations, which again will remain in recommendation form and unacted upon over the course of the coming months, and think about how those two things relate to each other. We will continue to consult as needed to sort of help make that process come to fruition. But the hope is obviously that by January, that the state will have a proposed approach to going forward that speaks to how the system will be run and how money in the system can be used more effectively to, produce results for children and families.
Thank you both. So to close out today's webinar, I want to say thank you to our consultants from Foresight Law and Policy and Watershed Advisors. I also want to extend my deepest gratitude to the Systems Analysis Advisory Committee and everybody who has provided feedback in this process. It's been an honor to facilitate this study and support Vermont's early childhood system. And in thinking about next steps for Building Bright Futures, we will be using time at upcoming State Advisory Council meetings to discuss this information and determine how we as a board will use it to make recommendations as a State Advisory Council network. We are committed to holding the system and our decision makers accountable to the vision we've outlined in the VCAP and really doing what's best to support optimal outcomes for kids and families. So please feel free to be in attendance at our regional council meetings, our Vermont Early Childhood Action Plan committees, and the State Advisory Council meeting, which is also a public meeting. So you're invited to attend, and we will support the administration and the legislature in any stakeholder engagement as needed and supporting the actual transition once Vermont determines the best path forward. So thank you for coming today. We're happy to answer any questions via email, and we look forward to seeing you all soon at an upcoming State Advisory Council. Thank you.